Hey, how are you today?
Good, thank you.
I'm Miguel. I'm going to be your occupational therapist for today. What's your name?
Lucy.
Nice to meet you, Lucy. This is Miguel. I work
Hi,
here
Miguel.
for the
Hi,
occupational
Miguel.
therapy rehab. Um, so I spoke to your previous OT before, and I have a better background information about you and the reason why you're here. So today we're going to go over what is called the stress questionnaire. It is based on 25 questions, and it should take about 10 to 15 minutes.
Okay.
So before we start with the questionnaire, I want to give you a brief description of what it's going to be all about, such as the benefits. So one of the benefits for the questionnaire is there is a simple instrument that we use here in OT for assessing stress in clinical practice. It also allows an early identification of individuals at risk for being stressed, right?
Okay.
The good thing about the questionnaire is that it's not really targeting any specific diagnosis, so we're not here to diagnose. Uh, you know, and like I say, it's based on 25 questions. The score will change, depends on your answers. I'm going to talk to you about the grading criteria a little bit. So let's say out of those 25 questions, if you get 4 or less, it means you're least likely to suffer from stress-related illnesses.
Okay.
5 to 13 points, it means that you're likely to experience stress-related ill health, either mental, physical, or both, right? So if you have 14 points and above, it means that you are more likely to be experiencing stress-related illnesses. You know, it could be from back or neck pain, it could be from high blood pressure, heart disease, strokes, depression, anxiety. And that being said, that would be very important for you to seek professional help or stress management counseling, if that is the case. So I'm going to go ahead and pull out the questionnaire. So like I say, I have 25 questions, so I want you to answer the question as honest as you can. Like I say, it's going to take anywhere from 10 to 15 minutes. So the first question, do you frequently bring work home at night?
Yes,
All
I
right,
do.
you do. Number two, do you feel like you don't have enough hours during the day to do everything that you must do?
No.
We all feel the same.
Yeah.
Do you deny or ignore problems in the hope that they will go away?
No, never.
Okay, so you get things done. Okay.
Mhm.
Uh, do you do the jobs? Do you do jobs to ensure that they are done properly? So you start something and you make sure that they're done
I
properly.
mentioned,
You do.
yeah.
Okay. So do you underestimate how long it takes to do things?
No.
Right. Do you feel like there are many deadlines at work, life that are difficult to meet?
Yes,
You do.
yes,
Oh, question number 7. Do you feel confidence? Do you feel like your self-esteem is lower than you would like to be?
I do. Yes.
You do. Okay, so number 8. Do you frequently have guilty feelings? Like if you relax and do nothing? Like sleeping all day, you get up in the morning, or, at 12, I don't know, then you feel like you haven't done anything. Do you feel guilty about that?
Yeah, I feel guilty when I relax.
Question number 9. Do you find yourself thinking about problems even when you're not supposed to be relaxing? Even though when you're supposed to be relaxing?
So,
You do? Okay, do you feel fatigued or tired even when you wake after taking a nap or in the morning?
sometimes.
Sometimes you do. Alright. Do you often nag or finish other people's sentences for them when they speak slowly? Like someone tries to talk to you, the person's kind of like talking slowly, and then you're trying to finish the word for them.
Yeah, always.
Always, all right. Question number 12. Do you have a tendency to eat, talk, walk, and drive quickly?
Every
Every day, okay. Have you noticed your appetite has changed, either a desire to binge or have a loss of appetite, or maybe skipping meals,
I skipping meals.
like eating too much, skipping meals?
I skip
You skip meals
Yeah.
frequently. Do you feel irritated or angry in the car or traffic in front seems to be going too slowly?
Every
You
day.
became very frustrated at having to wait, right,
Yes, every day.
on the expressway. If something or someone really annoys you, do you feel like you have that person have your feelings?
Yes.
When you play sport or games, do you really try to win whoever you play with?
Yes.
So 17, do you experience like mood swings, difficulty making decisions, concentration, and memory?
Yes.
Number 18, do you find fault and criticize others rather than praising, even if it is deserved? Like always trying to criticize people, even when they should be praising or be praised. I'm sorry.
No.
Okay. 19. Do you seem to be listening even though you are preoccupied with your own thoughts?
Yes, it is.
Okay. Have your sex drive decline? Can you experience changes on menstrual cycle?
No.
No? Okay. Do you find yourself grinding your teeth? Grinding?
No.
You don't? Number 22, do you feel any increase in muscular aches and pain, especially in the neck, head, low back, and shoulders?
Yes, I feel.
23, are you able to perform tasks as well as you used to? Your judgment is clouded or not as good as it was?
No.
All right. Do you have a greater dependency on alcohol, drugs?
No.
Question number 25. Do you find that you don't have time for many interests like hobbies and outside of work, like working out,
No, I don't have.
things of that nature?
I don't have time for this.
All right, so let's do this. I'm gonna go ahead and do this scoring for you really quick. So we talk about 25 questions. Let me see the criteria here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 12. So you scored 13 out of 25. So I'm going to tell you what that makes. 13 out of 25. There you go. Let me just change the screen here for you. Yeah, so you are within 5 to 13 point, which means you are likely to be experiencing a stress-related ill health, either by mental, physical, or both. So what I'm going to do, I'm going to set up an appointment for you next time. It's what we call an intervention or plan of care. I'm going to focus on stress management. I'm going to have you going home now, and you're going to have like a routine list they're going to be making to make sure that you are accomplishing things. Like, what are the things that you would like to do every day? You know, simple as getting up in the morning at the same time every day, like going to the gym, you know, things of that nature, like activities that you would like to make a list of priorities so you don't feel overwhelmed. So don't try to do everything at once, because that's when, you know, you get really overwhelmed. So we want to work on that. So do you think that will be something that you would like to do the next time we see?
Okay.
Are you open for that?
Yeah.
Okay. So Lucy, yeah, this is it. We're done with the screening, and then yes, hope to see you next.
Okay.
So I'm gonna give you an appointment. I want to see you in about 2 weeks. Okay.
Okay.
So it was a pleasure, Lucy.
Thank you.
Thank you very much.
Thank you.
You're
very
welcome.
much. Okay. Bye.